This presentation will be going more into depth about Parkinson's disease and medications used to treat it. So the case study once again is about a lady named Emma. She is a 70-year-old woman. She presented to a neurologist due to concerns for symptoms such as progressive bradycardia, rigidity, tremors, and postural instability over a 2-year period. She was also having trouble walking and frequent falls, and she was diagnosed with Parkinson's disease. The pathophysiology of Parkinson's. Parkinson's disease is neurodegenerative. Parkinson's is a disease which affects the dopaminergic neurons in the pars compacta region of the substantia nigra, followed by the aceciliin-based Lewy bodies formation. Parkinson's disease has for a long time not had a specific pathogenesis due to so much about the disease being unknown, and the limited ability for researchers to gain real knowledge about its progression. Parkinson's currently has no known cure due to this difficulty in research. The gradual death of dopaminergic neurons cause striatal dopamine deficiency. Specific mutations within further aggregation of the aceciliin in the intraneural inclusion bodies is considered the neuropathical hallmark of this disease. Parkinson's disease causes a wide range of other dysfunctions, including the production of reactive oxygen, which plays a role in neuron death. Mitochondrial damage and potential impairment are also seen. Parkinson's is most commonly known to originate from a wide range of both environmental and genetic factors. The degeneration of the nigrostriatal dopaminergic pathway involves various neural systems, causing several neuromediated dysfunctions that account for the complex patterns of functional deficits in Parkinson's disease. The pathogenesis of Parkinson's is characterized by various symptoms and presents in many different ways, including both motor and non-motor symptoms. These symptoms include resting tremors, bradykinesia, cognitive impairment, sleep disorders, posture instability, etc., with almost all of these being seen in the patient Emma. Genetically, Parkinson's has been studied to be linked to mutual mutations in genes such as alpha-synuclein, and environmental links include age, which is a leading link to Parkinson's, as well as diet. With Emma being 70 years old, this is likely the strongest link to her diagnosis, as people of an older age are significantly more likely to be diagnosed. Parkinson's is the most common movement disorder and comprises several pathophysiologic mechanisms, including misfolded alpha-synuclein aggregation, inflammation, mitochondrial dysfunction, and synaptic loss. Parkinson's is characterized by dopaminergic neurons over time diminishing, as well as particular decline in these neurons, which causes an increase in axonal processes. Misfolded proteins and mitochondrial dysfunction in synaptic terminals, which accumulate in DA neuron loss and impaired neurotransmission. Increased number of microglia, the primary effectors of neuroinflammation in the CNS, along with elevated concentrations of cytokines and phagocytic markers in substantia nigra, have been observed in toxin-induced and genetic models of Parkinson's disease and in post-mortem tissues of Parkinson's disease patients. The pathologic hallmark of Parkinson's disease is the Lewy body, a neural inclusion consisting largely of aceynuclein protein aggregation. It is hypothesized that the early first two stages of Parkinson's begin in the medulla and the olfactory bulb, both which sit towards the bottom of the brain. Stages 3 and 4 are in the substantia nigra, pars compacta, and other midbrain and basal forebrain. The pathological processes in these stages is compared to the motor symptoms of Parkinson's. Parkinson's is normally only diagnosed in stages 3 and 4. Parkinson's disease protein aggregations are associated with the dopamine-producing cells. Parkinson's disease currently has no known treatment or cure, meaning that all medications just aim to help alleviate symptoms and slow down the progression of the disease, most of which do so by increasing the amount of dopamine in the brain to help it perform better, as well as slow down neural degeneration and death. One drug that is often used in people with Parkinson's is often in conjunction with other drugs, is called levodopa. Levodopa belongs to a drug class called dopamine prosecutors, which are drugs that get converted into dopamine in the brain and restore the depleted dopamine. Levodopa, the metabolic prosecutor of dopamine, relieves the symptoms of Parkinson's disease presumably by being converted to dopamine in the brain. Following oral administration, levodopa is rapidly decarboxylated and converted to dopamine in the extracerebral tissues, and only a small amount of unchanged levodopa reaches the central nervous system. Thus, large doses of levodopa are required at frequent intervals for adequate therapeutic effect and are often attended by many adverse reactions, some of which are attributed to dopamine being formed in extracerebral tissue. Indications for levodopa include it is useful in relieving many of the symptoms of Parkinson, particularly rigidity and bradykinesia. Levodopa is used to help replace or increase the amount of dopamine in the brain for someone with Parkinson's disease, as due to the condition depending on the stage of Parkinson's an individual is in, the reduction in dopamine is the major cause of symptoms experienced by Parkinson's patients, including Emma, who experiences rigidity of movement, bradykinesia, postural instability, and more. Dopamine is a hormonal and neurotransmitter that works in communication and transmission of signals for movement. As with a reduction in dopamine, Parkinson's patients such as Emma have less fluid movements and signals aren't successful at all. Nursing considerations include, as many Parkinson's drugs, such as cinnamate, which is a drug that includes levodopa. If a patient is already on levodopa alone, but is being changed to a new drug that also includes levodopa, then levodopa alone must be ceased at least 12 hours prior. Also, side effects include nausea, vomiting, static hypertension, sedation, confusion, sleep disturbance, hallucinations, and dyskinesia. As a nurse to someone such as Emma, these symptoms should both be looked out for by continually communicating with the patient, asking questions, and overall observing a baseline prior to the start of this medication.